This is Health Call Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the Health Call Radio Hour. This year, cold and flu season, you may find a little bit of a problem if you're at the drugstore shopping for relief. There is a product that is now going to be missing from the marketplace because the FDA has finally come around to the belief that it really doesn't do the job. But the good news is there is absolutely effective products available in nature that you can use if you know what you're doing. And so that's why we're turning today to Greg Russell, clinical nutritionist, pharmacist, and founder of Fort Wayne Custom RX, to tell us more about some of these plant-based compounds that can really be your friends in the cold and flu season. But Greg, before we get there, let's back up a second. And what do you see coming now that the FDA has kind of come around to the fact that phenylephrine is not an effective product?
Yeah, for years, phenylephrine became the substitute for a product called pseudoephedrine. And pseudoephedrine, of course, is kind of the standout product for cough and cold season, and that is a great decongestant. And so, as you know, a virus gets into your respiratory tract, and it causes this inflammation and vessels in the nose and the sinuses. They start to dilate, they become leaky, and because they become leaky, we get this congestion that leads to things like headache, and of course, can eventually lead to coughs and breathing issues. So, I know everybody knows what a stuffy nose feels like. So, anyway, Sudafed became a product that had to be signed for, basically in the state of Indiana. I think most of the states are that way now. Or you have to get a prescription for it because, unfortunately, it was being abused in the abuse industry, and it's a raw precursor chemical to make those great home chemists make methamphetamine with it,
Yeah, right.
and abuse it. So basically, it became very restricted and more difficult to get. So the pharmaceutical manufacturer's answer was to use phenylephrine as a substitute. The problem with phenylephrine is it works fabulously topically, but the gut breaks it down very quickly, and so it tends to not work very well. And FDA finally woke up to that, and so now, of course, their timing probably couldn't have been worse. It's right before cough and cold season, so we know some of the major chains are already starting to pull these products that contain phenylephrine off the shelves. And unfortunately, I predict it might eventually end up causing a shortage of products, making it more difficult for people to get the traditional cough and cold medications.
Well, I'm going to go back and just recap that real quick. So the bottom line here is phenylephrine works as a nasal spray, but not as an oral. So you'll still be able to get the nasal spray. But
Correct.
there's a problem there too, right?
Yeah, I mean, neosynephrine is one example of a branded product. Another product is oxymetazoline. It goes by the brand name Afrin. Those are all topical decongestants that work well. But again, if you use these nasal sprays too often, you end up getting what they call a rebound and congestion rebound. And what happens is these drugs work topically. They cause those vessels to constrict, and that's great for a short-term period of time. But if you continue to use it over time and over time again, then you need to keep that constriction going, or you'll get the symptoms like having a cold, and obviously it can cause damage to the sinus cavities. But even more commonly, it just causes people to end up kind of almost addicted themselves to the nasal spray. So we typically recommend people not to use it more than 2 or 3 days at a time.
Yeah, and I suppose if you've got a cold, that might get you past it. But if you've got congestion due to allergies and other issues, yeah, now you have a bigger problem.
And there certainly are oral antihistamines, which do help work. Oral antihistamines can help during the cough season. The trade-off, cold and cough season, the trade-off on them is many of them can cause drowsiness. Right. And so, people don't want to be, drowsy. They already feel drowsy with cold.
And there are some people taking medications that you just can't mix with those antihistamines.
That's correct. Yep.
Yeah. Okay. So that brings us back around to an area that you've researched and supported by science. There are a lot of products available from the plant world that can work in our favor. My gosh, the Chinese have been using them forever. Native Americans used a lot of these products. And we are going to talk about them independently and then how you've put them all together into one easy to use kind of capsule.
Right.
So let's start there with some of these, and we'll just kind of start alphabetically, I guess, almost. Astragalus
And yeah,
is, did I say that right?
astragalus.
Astragalus,
Astragalus. Yeah.
astragalus.
Yeah, it's a Chinese herbal plant that's been used. Now, all of these products that we're going to talk about for the most part are what we call immunostimulants, at least immunomodulators. So, the problem you have is, again, even in the plant world, not every drug or every herb is appropriate for every person, right? So,
Hmm.
there are going to be people that should not be using some of these products. So that's my job, is to help screen that out. And so I'll put a plug in for pharmacists. Go to your pharmacist and talk to them before you just start using these herbs or buying them off the internet. So, for example, because they're immunostimulants, what type of patients should not have their immune system stimulated? Well, those would be patients that might be cancer patients, for example, maybe an MS patient. So these are people, that you have to be a little more careful with when you use it. But astragalus is a very potent immunostimulant, and it is you'll see that astragalus has been used for centuries by the Chinese, and there are studies now showing how it helps the T lymphocytes work more effectively. So,
Yeah, and your T cells are, well, they're the workhorses of your immune system,
they
so that
certainly
makes a lot
are.
of sense.
Yes.
So upper respiratory conditions, that's what we're talking about predominantly here.
Mhm. Yeah. So I love astragalus. And again, when we start using these plants, it's nice to use them in combination. And my theory on that is I like to use plants in combination because they give synergy. They all work a little differently. And then also we can use a little bit lower doses. So hopefully we kind of get to minimize any adverse effects. And that's kind of our goal too, make people as um, uh, safe as possible and get it.
Well, you know me, I'm always interested in learning more. So I took a look at astragalus, and I'm also seeing that it has some benefit for people with heart disease, diabetes, and liver conditions. So it has more than just that respiratory effect.
Yeah, it's considered a healing tonic, certainly by the Chinese. Yeah,
Okay. There's another one that we need to talk about. That's elderberry.
yeah.
Um,
Elderberry is a Native American plant
mhm.
grown here. People will get the elderberries. They'll pick them themselves. A couple cautions is the actual raw berry itself contains lectins. These lectins can cause a lot of nausea and vomiting. So they if you're going to collect elderberry, which I probably wouldn't recommend you do, but people make elderberry jam, for example, then you need to heat it. Heating it helps to get rid of that and makes it safe for consumption. So you do have to handle it very carefully, but you'll see elderberry syrups that are available quite a bit.
Mhm.
It comes in a variety of different dosage forms, chewable gummies. It's a favorite as for cough medications and lower respiratory too. And we have a product that's an elderberry product that we get from a vineyard. Uh, so it's handled. They grow it like wine, I guess. So, but
And what's its
non-alcoholic.
primary effect? And what
What's
is
that?
it? What's it doing? What's its primary effect?
Yeah. Well, its primary effect is that again, it helps with that sinus congestion and with cough, and we use a lot of it in cough medications. A uh, a study showed that it shortened the duration of colds by 2 days and decreases symptoms by 58%, almost 60%. So that's significant.
What?
Mhm.
Wow, 2 days and 60%. That's, yeah,
That's
that's worth doing.
yeah.
Yeah. Andographis is on the list. I've heard of this one. It's a South Asian plant, but tell me more.
Yeah, it comes from India for the most part. It's very bitter, so we won't typically find it in liquid preparations. But it is it also has the ability to. In our last show, we talked about superoxide dismutase being part of that enzymes that helps with glutathione and detoxification of the
Hmm.
liver. So it's used also in liver detoxification. So again, you're trying to get better. You're trying to use you're trying to eliminate the issues that made you sick, the virus in the first place. It does have a drug interaction with anticoagulant drugs, so it's one of the few drugs that in this series of herbs that we have to be careful with things like Coumadin.
Yeah. Okay. Got it. The other one that I've been it's been in my house forever, really, is echinacea, which, many people have the purple coneflower growing in their yard. That's
Yeah.
one form of echinacea. Native Americans use this. They chewed the root, they made tea, they used poultices. This thing's been around forever. And what's its primary benefit when it comes to cold and flu season?
Well, again, it really helps the immune system and increases the white blood cell counts. So it also, kind of like quercetin, it blocks the virus entry into the cell.
Hmm.
So it competes with the virus, and so people like it. I've seen all kinds of dosing on echinacea over the years, but it's generally believed to be very safe in general. One caution: we have to be careful with some of the different antihypertensives. It can block some of that effect. So. Something else, there are a percentage of people, for example, that are what we call slow metabolizers of caffeine. In other words, they drink a cup of coffee and it sits around in their system a lot more. My wife just so happens to be one of those people. Don't give her a cup of coffee after 12 noon or she won't sleep at night. So we call those
Okay.
people slow metabolizers. Well,
Yeah.
echinacea can increase plasma levels of caffeine by 30%. So for those people,
Wow.
there are some people that get, I guess I should say, get stimulated by echinacea. So we want to be careful
Okay.
with that, especially if they're, and there was caffeine and everything anymore, right? All these energy drinks. So we
Oh,
have to be
sure.
careful with
Yeah.
that.
Yeah. 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 Boy, I didn't know that about caffeine. Clearing that out of your system is it's so variable.
It's
Maybe
very
that explains
variable.
why I can drink coffee all the time and just not feel it really. That's
Yeah.
interesting. So, what's your recommendation on when do I take these? Is this something I'm just kind of keep on board through the season, or is this a response to an illness?
Yeah. So, how I like to use them is I keep a bottle on hand and I don't take it every day. And, we talked the last show, it was kind of like getting the trigger ready, right? We pulled the
Hmm.
trigger. We talked about all those supplements to help get the trigger ready. The products we're talking about today is what's actually pulling the trigger, getting the immune system to fire when it's ready. So what I'll do is if I start feeling something coming on, that's when I'll start taking this product. And this product's kind of interesting. You can take 2 a day, for example. If you kind of feel like a cold's coming on, or you want to just start, before typical time of the year where you're having guests coming to your house and you're going to be more
Hmm.
susceptible, then you start taking 2 a day. But it's safe enough for most patients. They can take 1 or 2 an hour when the symptoms first start to show up. Of course, I'm not
One or
saying
two
take a
an
whole
hour?
1 or 2 an hour, yes. And
Wow.
so, we have a product called Immuno Support that I like. It's kind of the other half of the immuno defense, which we talked about last week,
Right.
last
Right.
last episode. And I like these 2 products together because I use them together. And one is just trying to get the trigger pulled. The other one is releasing that trigger so it's ready to fire.
Okay, so immunodefense is something that I take ongoing and just to be prepared. And then when I begin to feel sick, now I jump over into this blend of all those plants we just discussed, immunosupport.
Right. Right.
Okay,
So that strategy seems to work well for me and for many of my patients that we've used.
got
The
it.
whole idea
Okay.
is to get that cold before it gets severe. So you have to kind of
Oh,
listen to your body. You can feel it coming on.
man, that's the key to so many things, isn't it?
Yeah, for sure.
So that's the plant-based supplements that we wanted people to know about, and you also mentioned that homeopathic remedies are available now. I think a lot of people are skeptical about that, but you're a believer. Tell me more about that.
Yeah. So I mean, homeopathy is probably one of the most misunderstood sciences, and I'll be honest with you, even I don't understand it. But it's historically used in this country up to about the 1900s. It was a major source of medicine. And just a little brief history. Most doctors were what they called homeopathic doctors. And back about the 1900s, many doctors shifted into what we call allopathic, which is the type of medicine we use today. So homeopathy basically says, let's look at an ingredient. If there's a certain ingredient that causes diarrhea, then if we use this and we dilute it way down, and there's a specific way they dilute it, then it actually is used to treat diarrhea. So it's almost kind of like it
Hmm.
has this immune, again, the science is bewildering to me. I've never understood it. But what I can say is for some people tend to do well with treatment. So some products tend to be kind of a combination of homeopathic and allopathic medicine, but many products are still totally homeopathic too. So one of the products, for example, that I love and I keep on hand at my house is a product called Chestol, cough and cold. And it's basically a syrup, and it comes in both adult and children doses. And we use this if we start getting develop a cough. And I love it because I have it for my grandkids, and I got a 3-year-old and I got a 7-year-old that come over quite frequently. And so, we know those kids are always going to be bringing cooties over, right?
They are little petri dishes.
They're going to be bringing us
carry it with.
Plus, we want stuff for them when they're here safe. And so it seems to work well. And we love this product because it's pretty safe. Caution because it does have some honey in it. Maybe a type 1 patient with diabetes would not be appropriate for this product. But
okay,
in general, safe for pregnant women, used in children of all ages. And, products are safe.
Chestol
is
one
the
name of that. And it's it's on the shelf, huh?
Yeah, and then we have some other products that we use for like flu and things like mucus oxalicoxicum, and don't ask me how to spell it, or mucocoxicum. These are all homeopathic products too, and they seem to help too. And when first onsets of flu, and so I love these products too. Again, safe, for most patients.
Yeah. Okay. So the best way for me to understand what's a good fit is to just come in and have a conversation, right? It's so funny. We hear just recently that many of the big national drugstore chains were having people who pharmacists refusing to come to work. They were just protesting. They were almost on strike. So people may be hesitant to come and talk to a pharmacist, but that's what you're there for, right?
Yeah, frankly, if I had a crystal ball, I never would have predicted what I'm seeing today. Pharmacists traditionally have been always available for their patients, but in today's healthcare environment, they have incredible hurdles in these chain drugstores that make it difficult to get to the patients. One of my philosophies is always to try to have pharmacists available on the floor, so if people come and ask a question, we're there to answer it. That's part of our job, and so I think. That's one thing we can offer patients. And, this is the time of the year to start thinking about stocking those medicine cabinets. Nobody wants to have to run out at 2 a.m. to try to find something, especially today when the pharmacies aren't open. So having a well-prepared, stocked cough and cold, armament of munitions is really important to have, I think.
So if you're interested in doing that, and you know what, I think I'm going to be on board with that, Greg. I like that idea of having those products ready to go when I need them, so I'm not struggling to get through cough and cold season. And so you can always do that by visiting with Greg Russell and his other pharmacists on the team there at Fort Wayne Custom RX. You'll find them at 425 East DuPont Road, also online at fwcustomrx.com. Greg, good as always to talk with you.
Great, likewise. Thank you.